many of us have just you and other patients in mind, and that to cure patients is also the driving force for many of us. And as far as I know, there is also an investigation at the NCI in the US looking into cancer survivors, but I'm not sure whether in Europe is a project like this. Maybe you can answer this, Eric, or someone else?
Yeah. There are some plans, and Carlo can update us. I see Carlo is standing up already. There are some plans also within the ERTC to look at cancer survivors and long-term survivors, and to. But true. Carlo, maybe you can update us more.
Yeah, that's true. A few weeks ago, we had the first summit of cancer survivorship. This is very much wanted by Madame Munier, the president of the organization. And of course, there are many questions like what happens after cancer is cured. You know, patients can get an insurance, can get a mortgage. Do they get later toxicity or secondary cancers due to the treatment and so on? So the first summit was held in February in Brussels. And of course, there are many ways how to integrate these. You know, if our insurance company willing to share the data, perhaps with our organization, and cross check those data. So there are many initiatives currently. Not many initiatives currently, but for sure there is one of URTC, which is the Cancer Survivorship Program. So this is a small update in Europe. I don't know about the US.
I'm sorry, but we're not just talking about survivorship here, because I do understand it's a huge issue. But this is a particular case where a woman who was given 4 months to live, 7 years later is still alive, and having had only one kind of treatment. So there has to be something in that treatment and her makeup, her DNA, whatever, that is making this happen. So what can the EORTC do? Can you take a group of patients and investigate their tissue?
Well, as Eric already said, we are setting up Spectacular, which is a screening platform for high-risk colorectal patients or stage 4 colorectal patients. So there was Gunnar Folprecht, that is the PI of this initiative. As far as we are concerned, we're also consortiating with the European Society of Pathology and the Sanger Institute to have next-generation sequencing performed in a panel of almost 400 genes. So, of course, there are baby steps. They are not giant leaps, but and Barbara is integrating part of that platform. I mean, she's part of the steering committee. We know that, and it's beautiful talk as usual.
Barbara, how many patients, like, I don't know your particular story, but clearly there is a role in studying rare diseases. You know, if we had not studied patients with medullary thyroid cancer and pheochromocytomas, we would know nothing about proto-oncogenes, and there's only a few hundred patients in the world. It's not a common disease, but we learn a lot. So you are not a common patient, but we can learn a lot from patients like you. Do you have a group of patients like yourself who are quote-unquote miracles? Because obviously the yield of sequencing somebody like her is infinitely higher than sequencing thousands of patients with responses scattered all over the place.
I don't think this needs to be a large group of patients, as in rare cancers. And when you look at the bell curve, and most of the patients there would fall within one end or the other, so the average patient actually doesn't exist. And I think my reaction has been as exceptional as that. I'm at the top end, and there's no average in cases like myself. And so you need to just look at the one end, not the average patient anymore.
Yeah, no, that's the point. But you need to look at the exceptions.
I would also like to ask a different question, if I may. Professor, Picazzi, when you talked about transanal surgery, can you tell me what are the side effects for the patient, the sphincter muscle, and all the consequences of going in that way instead of coming down that way?
Yeah, it's a good question. You know, we have not done too many of these procedures to know definitively, but the preliminary evidence is that there are no adverse effects on the sphincter muscle. The morbidity seems to be overall about the same as what we will get with a transabdominal approach. No major differences, but the studies are still very small.
Right, thank you.
Okay, other questions? Maybe I have a question on the Sentinel node. Is that going forward in the near future in Column?
Not really. You know, every year it goes up and the next year it goes down. You know, there are studies that shows that there's clearly some upstaging in terms of being able to really sequence and do all kinds of studies on the one node that is more likely to harbor tumor cells. But whether that translates into improved survival and lower recurrence has not been shown. So it's time consuming, and at this point it's still experimental. Maybe for rectal. For rectal it could be a different story, but it's harder.
So I think, unfortunately, we have to conclude this very interesting session. I'd like to thank you all for your contributions, and I hope that we'll have an interesting and future, and that we, especially with your experience, Barbara, that we'll have some research that can follow this up. So I wish you all a good night, and I'll see you back tomorrow.